In the name of God, the most compassionate, the merciful. Hello everybody, I'm Dr. Tahir Ali Zamir, the Assistant Professor of Anatomical Sciences from the Hamadan University of Medical Sciences, Iran. In this presentation, I want to speak about the cardiovascular system. The cardiovascular system is made from the heart, arteries, and the veins. This system, by these elements, is a start from the heart. I want to start from the heart. But before starting, you must know about the place and the location of the heart. The heart is located in the mediastinum. But what is the mediastinum? Mediastinum is a cavity which is located and limited by this element, as I tell you. From the anterior, it is the sternum. From the above, we can see the margin of the first rib. From the posterior, we can see the vertebral column here till the thoracic part. And from the beneath, we can see the diaphragm. But by the location and the place of the heart, and by some lines which it is just conventional, we can divide the mediastinum in small cavities too. The first one is the superior mediastinum. The superior mediastinum is located above this line, as I tell, what is it? To the first rib. So it is the border and is the place of the superior mediastinum here. Superior mediastinum. This line is a conventional line which just we say there isn't any real line here. Just for better understanding, we name and say this line. It passes from the space between the manubrium and the body of the sternum to the intervertebral disc between the fourth and fifth thoracic vertebra. So it is the superior mediastinum. But the heart is located in the inferior mediastinum. But the inferior mediastinum also has three small cavities too, or divided in three space too. The first one is the anterior mediastinum. The anterior mediastinum is a space between the sternum from anterior to the heart, from posterior to the heart. After the anterior mediastinum, we can see the middle mediastinum. Middle mediastinum, in fact, is a place for the heart. So pericardium is a place, we can also see, in fact, it is the middle mediastinum. And after that, we can see the posterior mediastinum, which is located between the heart from anterior to the vertebral column from posterior. Okay, let's start speaking about the heart details. The heart has four surfaces. The first one is anterior sternocostal surface here. Another is inferior. The inferior surface is a surface which the heart is located above the diaphragm here. The next one is the left, or the pulmonary, and the last one is the posterior. Or another name for the posterior surface is base. So if I want to guide you about the shape, about the mathematical shape of the heart, I must say that it is like a pyramid by the base and three surfaces. These surfaces are limited by some borders. The borders are here. One of them is right here, another is left, the next one is inferior, and the last one is the superior, and in fact it is the border which the arteries are near to this part. Okay, I want to start from the right atrium because the heart has 4 cavities. Both of them, two of them are both of them are located superiorly, and both of them, another cavities, are located inferior. The cavities which are located superiorly, called their name is atrium, and the cavities which are located beneath and inferiorly are ventricle. In the atrium, as you see, both atrium, also right and left, we can say these cavities are like a place for accepting and receiving and drainaging the blood. But the ventricles are a place for forwarding the blood to any organ of the body, for the left ventricle, and to the lungs for the right ventricle. So, because the right ventricle is a place for drainaging all the blood of the body, we can see 3 foramen for accepting and for communicating with the vessels which they drainage the blood to the heart. Which vessel drainage the blood, artery or vein? Yes, the veins are the vessels which drainage the blood. So we can see the vessels which are communicated with the right atrium, and because as you see here, the heart is located in a place which that we can see some organs above and some organs below the heart, so we must have a vessel, or exactly as I want to say, we need to vein for drainaging the blood from above of the heart, and we need a vessel for drainaging any organ blood from below. So we need 2 large vessels, SVC and IVC. And for drainaging the blood of the heart, we need a vessel, we need a vein, which its name is coronary sinus. So these 3 foramen are connected and communicated with the right atrium. After accepting and drainaging the blood to here, all the blood must go toward the right ventricle, because this blood is dirty. It has many carbon dioxide, and it is obvious for having a good circulation we need more oxygen. So for this refreshing, the all blood volume goes toward the right ventricle by the tricuspid valve, and after passing from the tricuspid valve, the blood is located to the right ventricle, and by the pulmonary arteries, the blood goes toward the lungs and become refreshed and get more oxygen, and after that they come back to the left atrium, because we told you, as I said, the atrium are the acceptors station of the heart. So the blood volume become here, received to here, and by obviously by 4 vein, both of them from right lung and to another from left lung too. And after coming here by the mitral valve, the blood volume goes toward the left ventricle, and in the left ventricle by the aorta we can see the sending all the volume of the blood to all over the body. This picture is taken from the posterior inferior of the blood of the heart, so you can see the aspect of the posterior here from the heart. It was a simple explanation about the heart circulation, but there are some notes. Let's see here. In the wall of the right atrium, I mean the wall between right and left atrium, we can see a fossa, which its name is fossa ovalis. The fossa ovalis has a embryologic reason, and it refers to the development of the walls between the right and left atrium, because in the first stage of development of the heart, we can see, and we don't have any wall between the right and left atrium. But moreover, by having a good development, this wall is made, and they become by the birthing, these two walls fuse to each other. If there isn't take place, so we can see some malformity and abnormality here, and it is the fossa ovalis. So by this reason we can see a thinner wall here, about the thickness I mean. As I said, the tricuspid valve is a valve between the right atrium and ventricle. This valve is connected by some papillary muscle, with some papillary muscle, by some tendons, as you see here, for adjusting and controlling the opening or closing the valve. Of course, it is the mitral valve. The mitral valve is between the left atrium and ventricle, and because the left ventricle needs to a more powerful pumpage for drainaging the blood from the left ventricle and send it to all over the body. So the thickness of the wall, left ventricle wall, is more than the right. In both right and left ventricle, we can see three kind of the muscle: the ridge, the bridge, and the papillary. The ridge muscle are the muscle like this, like some lines here, as you see, or trabecula. And the bridge is a kind of the muscle which they are suspended between two walls and the cavities. And the last one is the papillary, which they are like a place for attachment of the valve by some tendons. The physiology or the function of the bridge muscle is connecting the wall of the ventricle for having a good and for more coordinating for heart beating. So it is useful for this. as you see the foramen oval and the part of the atrium and ventricle in the left. The left ventricle is connected with the aorta, but the right ventricle is connected to the pulmonary arteries because as I said, we need to nourish and refresh the blood. So the blood send the so the heart send the blood to the lungs by the pulmonary arteries, and after refreshing they come back and goes toward the left atrium, and after the left atrium we can see the blood pass toward the left ventricle by the mitral valve, and after that by the aorta. All the volume of the blood goes away from the left ventricle and goes toward the any tissue of the body. You can see the valves of the heart. We have two kinds. One of them is the valves between the atrium and ventricle, as I said, mitral and the tricuspid valves, and another kind are the valves which are located between the ventricle to arteries, because the ventricles are connected to the arteries, not veins, because they want to pumpage to send the blood volume. So for not letting reflex and goes back to the ventricle, these valve exist here, and we call them semilunar valves. It is the shape of semilunar valves or semilunar cusp here. They has a mechanism like this. They let the blood goes away from the heart, but they can let the blood to goes toward and come back. So it has a mechanism for helping the ventricles to send the blood to the body. Okay, after speaking about the details of the heart, let's see about the arteries. I have a question. Think about it. Which part of the aorta is specialized for sending arteries to own heart? Can you tell me from which part? I answer this question. It is the first part. The first part from starting the aorta is a place for coronary sinuses, coronary arteries. The coronary arteries are the branches from the starting part of the aorta, and it is very obvious why. Because the heart is the first station for needing more oxygen and more glucose and etc. So as the aorta is started, the coronary arteries are branched and goes toward the all part of the heart. It is sufficient for the first part, and in the next lecture I speak about the remaining part of the cardiovascular system. Have a good time.